Hey, it's Laura from Train to Respond. Thanks for stopping by. This is part 2 in the deadly triad of trauma, and today we're going to be going over coagulopathy. So coagulation is a complex system of the body, and it's really the ability to form clots, and this is what helps you stop bleeding should you be injured. Coagulopathy, on the other hand, is a group of diseases that impair the body's ability to form these clots. Coagulopathy is dependent on two things. It's dependent on how warm the patient is. So we already went over hypothermia, so we know we don't want to let our patients get cold. And also the pH of the body. So are they acidotic, alkalotic with that? Coagulopathy is very dependent on that. In victims with chronic liver disease, with using blood thinners, so anybody on blood thinners, obviously that's going to decrease the body's ability to form a clot. And anybody with renal failure has an increased problem with coagulopathy in trauma especially. They're finding too that if you're a medic or an MICN or anybody who's, an ER doc, ER nurse who's initiating IVs, that if you overuse IVs such as normal saline, lactated ringers, even blood products that don't contain the clotting factors, that's going to actually dilute the remaining clotted factors in the patient's blood. So we don't want to overuse any fluids and obviously normal saline and lactated ringers don't have clotting factors in them. So we really want to think about that and keep that in the back of our minds when we're initiating IVs on trauma patients. Don't overuse them. And also, any cold IV fluids or blood products, obviously, that's going to cause hypothermia, and that affects coagulopathy. So again, we want to make sure, especially in the winter, that you have IV fluids or IV warmers for your fluids in your truck. So again, hypothermia went over. We want to make sure we keep our patients warm. And coagulopathy, a group of diseases that's going to decrease the body's ability to form clots. In the next video, we're going to go over acidosis, which is the third part in the triad of trauma. And then we're going to go over part 4. We're going to go over the treatment. What can we do for these folks that are injured? And this not only goes for EMS folks, but for fire, police, and for any bystander that's helping a trauma victim. I'll see you in the next video. Thanks for stopping by.